This is the sixth in my series of 7 short videos about zero harm. Sometimes when we talk about frontline leadership, those in an organisation who see themselves as leaders get worried. The zero harm system does not negate their leadership role though. If anything, it crystallises it. Zero harm leaders would often be seen out there with their own staff, motivating and encouraging them, understanding the issues and difficulties they may be facing, appreciating how much they've achieved, spotting potential problems early, and of course be spending lots of time with the patients themselves. Those who stay in their offices poring over their spreadsheets may be great administrators, but they're not leaders. Those who have to be told to talk to their own people every day are not leaders. Zero harm leaders would be well and truly on top of what's really going on in their wards, in their operating theatres, everywhere in their organisation. They would experience and feel what it's like to be a patient receiving one of their services, because they would be regularly in touch first-hand with what's going on. Those who talk about this interfering with their day job don't understand what kind of behaviour that word leader requires. So if we have in our healthcare services leaders who truly enjoy being with their people, the patients, and experiencing some of what they experience and understanding what it's like to be on the front line, then the chances are that we already have a great store in the NHS of people who could be the kind of galvanising leaders needed to make zero harm a reality. They will already understand that giving the leadership baton to the front line in the zero harm context is the way to make it happen quickly and with the maximum buy-in from the people on whom we public and patients most rely for our health care. And what does frontline leadership actually mean? It would mean that nurses, healthcare assistants and doctors, or records clerks, porters, who notice something that could be a hazard to patients just get on and do something about it, because they're confident of the support of senior management. Some sectors allow frontline workers to stop the production line if they spot something wrong. That should be the same in healthcare. In zero harm organisations it will be. It would mean that a struggling worker is not left to make mistakes but is immediately supported by colleagues. It would mean that the dreadful bullying treatment meted out to vulnerable patients in Mid-Staffs Hospital would be immediately challenged and stopped by the perpetrator's colleagues. It would mean that every single person in the healthcare system would see poor behaviour towards patients as an unacceptable reflection on their own professionalism. In other words, it would mean that patients and their loved ones receive the kind of caring behaviour that we all expect from healthcare professionals. In the 7th and last video, I'll talk about making a start towards zero harm.